Well, a lot to unpack because spring is here and the weather is getting warmer, but spring also means a lot of pollen.
Seems like it's bad this year, doesn't it?
Real bad.
Yeah. Increased pollen in the air can make it tricky for people with allergies, And to talk more about this, we've got an expert with us this morning. We have Dr. Khaled Girgis with us here. He's from HCA Midwest. First off, welcome in. It's great to see you.
Thank you. Thank you for having me. Thank you.
First off, is this year supposed to be a bad year for seasonal allergies?
I think this year I've seen levels for both pollen and mold counts that were much higher than usual, especially for this time of year. This is the time when tree pollination starts, usually early March, and it progresses into the following 2 months, and we get to see a decline in tree pollens usually by mid-May to late May, and that's when grass pollination starts. This year we've seen some grass pollens mixed with the tree pollens, but usually it's not because the grass is pollinating here, but sometimes the wind can carry it over from southern states and can affect people with grass allergies early on when they're used to having their grass allergy symptoms towards mid-May or late May. So it's been hard, and then we saw also significant elevation in mold counts. As of yesterday, it was one of the highest levels I've seen in a very, very long time.
Wow.
Yeah. And Nick and I, we both suffer from allergies on all sorts of medication. What's your advice for those who are suffering from allergies? What should they do?
People with allergies, if you're allergic to pollens, well, your exposure is mainly in the outdoors, and that's when people suffer with prolonged outdoor exposure, and we always advise that avoidance is one of the most effective methods, but not everyone can implement avoidance, meaning they're not going to stay indoors for 8 or 9 months of the year, so they need to be out and they need to enjoy life, and that's the role of medicine, which we have to add so they can counteract these symptoms and enjoy a normal life.
Yeah.
Sometimes, go ahead.
Well, I'd say, what do you recommend in terms of over-the-counter medications that can help us with seasonal allergies?
Fortunately, it's much better these days compared to 10 or 15 years ago, when most of the current medications were all by prescription. So every consumer has access to several antihistamines and nasosteroid sprays and antihistamine sprays. So this is when the role of an allergist comes into play. So you would have probably visit with an allergist, perform skin testing, figure out what is your worst triggers, what your allergens are, what allergens affect you the most, and based on that you can devise a plan that you would follow both for avoidance and for medications. Not every medicine acts the same way for every patient, so there will be sometimes a trial and error, and see how the patient responds, and that's the function of your allergist that can navigate you through that.
I'll follow up real quick here. I know that there's some prescription medication that you can take orally for allergies. How about shots? I've heard shots can be effective for allergies.
So allergy shots are, scientifically speaking, are called allergen immunotherapy because this is the closest thing we have to achieving therapy. When you're taking medicine, you're treating the symptoms, but allergy shots is a way to introduce the allergens into your body at a different level than your daily exposure, which would lead the immune system to train different kinds of antibodies that would counteract those allergens during your exposure and during the allergy season.
And you see these have proven effective?
So far, it's proven very effective, and I've seen excellent results. It helps reduce the severity of your allergies, which would allow you to enjoy life more and benefit more from your medications, even if and some people can be lucky and they would eventually be on less medicine as they progress through the allergy shots.
Okay. Right. Well, if people have more questions or want to get in contact with you about their allergies, how can they do so?
Well, I work with the College Park Family Care Center, which is part of HCA, and I'm in their Lenexa clinic on 87th Street, and feel free to contact me anytime.
I know a lot of people out there sniffling and sneezing right now, Dr. Girgis.
Yes,
so,
yes, and
yeah.
you know, the best is yet to come.
Okay. Hey, thanks for your time. We really
thanks for
appreciate
being
it.
here.
Thank you.